Good afternoon, ladies and gentlemen. I'm Paul von Ebers, President and CEO of Blue Cross Blue Shield of North Dakota. I'm here to talk to you today about the court's historic ruling affirming the Affordable Care Act, the health reform law. As you know, this is a very historic ruling. The political debate will go on about this law. I'm sure that we'll be hearing much more about it from now until the election. But while the political debate goes forward, Blue Cross Blue Shield of North Dakota will continue to implement the law as we have been doing for really most of the last 2 years. As you know, many elements of the Affordable Care Act have already been implemented and are in place, and there are many more pieces of the law that will be coming online over the next year and a half leading up to January of 2014, when the full law really takes effect, that will affect the people of North Dakota. We will continue to implement the law as we have and continue to work with both our state and national elected leaders to improve certain aspects of the law. One thing that you may know is that the law did not do a lot to address the cost of health care in the state. And Blue Cross Blue Shield of North Dakota is committed to addressing that issue. We already have a number of initiatives underway with hospitals and physicians across the state to collaborate on controlling the cost of health care. We've enacted new contracts with hospitals and doctors that provide incentives for high quality of care and lower cost, and we're supporting primary care physicians to provide better care, especially for those patients that have chronic disease. We've also implemented many wellness and prevention programs which will help people stay healthier. All of these activities will support the notion of lower healthcare costs and higher quality, and we're committed to finding those solutions for the people of North Dakota. Now, there are certain aspects of the law that we are interested in seeing changed or to see in North Dakota involvement in the law. For example, currently the state of North Dakota has deferred to the federal government to run the health information exchanges that are required under the law. We have strongly advocated for a state health exchange, and we will continue to work with our elected officials both here and in Washington to see if we cannot achieve a state exchange for North Dakota. We think it's always better when North Dakotans have the opportunity to shape their own healthcare system instead of relying on the federal government. In addition, there are some aspects of the law that will actually increase healthcare costs and health insurance premiums. The law includes a tax on health insurance, which will raise the price of an individual policy by about $60 a year, and will raise the price of a family policy by about $200 a year. We don't think that that's an appropriate policy approach, and we will be working with our delegation in Washington and others to see if we can't eliminate that tax and replace it with another funding mechanism. Finally, there are certain aspects of the law that will tend to raise the prices of insurance for younger people. We do have programs that we hope will be able to moderate that increase for younger people, and we'll continue to work with the policymakers to see if we can't modify that aspect of the law. But in many respects, we're committed to moving ahead with the law, and we will continue to go forward with implementing it. And we are happy to see that the Frontier Amendment that will provide higher Medicare payments for hospitals and physicians in the state will go forward. We have been concerned about low Medicare payment rates, which does affect what hospitals and doctors ask Blue Cross Blue Shield to pay, and so we're happy to see the Frontier Amendment continue to stay in place. That's just a very brief statement on our approach to the law, and I would be happy to take any questions that members of the press might have. And I would just ask if those on the phone, if you ask a question, would you please identify yourself? I'm just going to start with a question or two here in the room, and then I'll turn to the phone and be happy to answer those questions as well.
Would you like us to identify ourselves too? Or?
Sure, that would be helpful.
I'm Dave Thompson, Prairie Public. I was just curious, when you heard about the ruling, were you surprised by it?
You know, I've been doing my best to not have an opinion on what the court would do. We're not constitutional lawyers, and we don't watch the Supreme Court professionally. So we've really tried to stay even-handed about what the court might do. And as you know, there's been speculation that has run in every direction about what the court might do.
I'd like to follow up also about the healthcare exchanges. The legislature did back away, and then they had a special session, didn't do anything about it. Was the deadline in the bill January 1st, 2013? You had to have a plan ready to go?
There are deadlines that relate to federal funding, and we have passed several of those deadlines. I believe there is some hope among some states, I'm not just referring to North Dakota, that there might be some extension of those deadlines. So we're not giving up hope for a state exchange. To be quite honest, we don't think anything will happen in North Dakota until the upcoming session in January. That would really be the earliest. We would not expect action any earlier than that.
Sarah Gustin, Cats News. When could insurers possibly see their rates go up and their plans go up to the $65 and $200 too?
That would be in 2014 as the insurer tax really takes effect. That's when it would really be applied to our premiums.
And when you said that the younger people could be seeing higher rates as well, what age range are you looking at? Are these healthy individuals that are just under a current plan? Or?
Right. As you know, young people up to the age of 26 are now able to be included on their parents' policy. But not all people up to age 26 have that opportunity. They may just not have a parent that has that insurance option available. So there are young people who are uninsured. The law basically sets guidelines on any variations we can have between what we charge younger people and older people, and the law narrows that, which basically means that premiums for older people would go down and premiums for younger people would go up, and by narrowing that range. It does cost quite a bit more to insure, for example, a 55-year-old man than a 25-year-old man. And it is roughly a 5-to-1 difference between the cost of a 55-year-old and a 25-year-old. The law says we can't have prices that vary by more than 3-to-1. So that means the older prices would come down and the younger prices would go up. Generally, people who are living at home and dependents will be on their parents' policy and won't be directly affected by it.
Michelle Sang-Miguel with KFYR TV. Could you talk a little bit about the total cost of care contracts and how that's going to work?
Yes, these total cost of care contracts are agreements that we have with several health systems, and we hope to have all of the large health systems in North Dakota covered by them relatively soon. These contracts do reward hospitals and physicians if they hit higher quality targets. And the quality targets are mostly around gaps in care, and by that I mean that a diabetic would get all the care they need in a year. So if they haven't received all the care they need, and the physician does provide that care and gets all those gaps in care closed, they would receive higher payment. And then there is also an incentive for lowering the cost of care. And we've agreed upon targets for cost of care, and that is at a lower rate of inflation than otherwise would have happened.
And how will you measure that? Will you be surveying patients, or how is that going to be measured?
That will be measured through the claim information that comes into Blue Cross Blue Shield. We will be gathering all the claim information, and we'll be able to evaluate where the costs are, and we'll also see claims for those quality indicators. So we'll see that someone actually was at the doctor and received the service. Are there questions for people on the phone?
Hi, this is Pat Springer from the forum. Do you have any way of estimating how much more competition there might be in the private health insurance market once these health exchanges are in effect? Do you expect to see more competition in North Dakota?
Yeah, hi Pat, a great question. It's difficult to estimate exactly how many new competitors might come into the state based on the law, but we do expect more competition. whether we have a state exchange or a federal exchange, we do feel that other insurance companies will view that as an opportunity. It will lower their marketing cost, basically, and make it easier to enter the market. In a sense, the government, either the federal government or the state government, will be presenting these competitors to the marketplace and make the cost of selling their product cheaper, and so we would expect more competitors to come into the state. I can't really predict how many companies will come into the state, but we would expect some of the companies who are already operating in the state, plus some national companies, are likely to be here. But to say exactly how many, I just can't guess.
If I may, another question. There's a lot of uncertainty about how employers will respond, and small businesses are going to have some incentives, but there's been a lot of talk where some employers might decide it's cheaper and better to just take the penalty and allow their employees to go on the individual, health exchange market for insurance. Is there any way of predicting how big of a shift we might be seeing from employers either embracing or not embracing, the continued insurance for their employees?
Yes, this is a very important issue. Some employers will find that they have employees whose wages are low enough that they might qualify for subsidies on the exchange. And if they do qualify for subsidies on the exchange, it may make sense in some cases for the employer to drop their group coverage and send their employees to the exchange. And in some cases, the employees could be better off. And so we do expect some employers to make that decision. We think it will happen slowly over time because many employers are worried about retaining high-quality employees, so they won't jump into this immediately. But as they see the process working, we do expect some employers to drop coverage, and Blue Cross Blue Shield of North Dakota is prepared to help employers understand their own situation and make whatever is the right decision for their company and for their employees. Do we have someone else with a question? I'll stay on the phone for a moment. Do we have another question from the phone?
I don't want to monopolize, but if nobody else has another question, I have another one.
Okay, we'll give you one more, Pat.
Do you have any concerns about what might happen if, with the Medicaid expansion program, there are some indications that the effect of this ruling might be that states will have more flexibility in whether and how much they expand Medicaid, and what might that do to health insurance coverage? And I don't know if there are any effects to you, but how do you see it? Any thought on that?
This is one area that we're not entirely clear about so far. The Supreme Court ruling, I think, runs about 190 pages, if I heard correctly, and we certainly have not received a complete analysis of it. There is a little uncertainty around the Medicaid issue and how much flexibility states might have. If a state, like North Dakota, ends up with the flexibility to opt in or opt out of this expansion, then it does create a problem with the law, in that people between 100% of the federal poverty level and 133%, it would appear to us that they wouldn't be covered by either the subsidies or Medicaid. Now, we don't know enough yet to know whether that interpretation is correct, and I don't mean to be spreading a rumor, but that's the question mark that needs to be answered by careful reading of this ruling. And we just don't know the answer to that yet. So, Pat, the simple answer is we don't think it affects Blue Cross Blue Shield directly, but it certainly could affect the state of North Dakota and the Medicaid program.
Thank you.
Other questions here in the room? Anyone else?
What are some of the preventative services that will be covered without out-of-pocket costs initially?
And I don't have the complete list in front of me, but there's a fairly broad range of preventive services that are in fact covered now under the Affordable Care Act without a copay or a deductible. And that we do think will ease the way for people to get the preventive care that they need. we're strong boosters of the idea of everyone getting the preventive care that's recommended, and this law does facilitate that. So we do think that that piece of the law is a positive piece. Anyone else on the phone with a question? And we're certainly willing to follow up also for any of the news organizations. If you think of a question later in the day and you want to get back to us, we're certainly happy to do that. And any other questions from anyone just before we wrap up here?
I have one more. Is the state in a disadvantageous position, having placed itself on the sidelines as far as pursuing a state health insurance exchange? Are we kind of behind the eight ball now, quite frankly?
Yes, we think the state is in a disadvantaged position by not having a state exchange for several reasons. First of all, this means that the federal government will have a bigger role in deciding the description of products that are on the exchange, and also which health insurance carriers can be on the exchange or not on the exchange. And we would prefer to have that be a North Dakota process. So we do think it's a disadvantage, and we'll continue to urge our elected leaders here in North Dakota to re-examine that issue. As I said, we don't think there'll be an opportunity to do that until the next session in January, and then we may not have much time to respond.
So at this point, it's really a timing issue in terms of if the state wants to pick up a ball and run with it on exchanges.
We will have a very narrow window of opportunity to respond. The exchange, whether it's a federal or state exchange, need to be up and running by October 2013 so that people can make their choices prior to January 1st, 2014. So starting in January, there's really only 9 months, and that's not a lot of time to get ready. There is some hope that those deadlines might be delayed, or that the state could take back an exchange from the federal government at a later time, but how that would work is not clear. Well, thank you very much, everyone, for being here today. We appreciate it. As I said, I think we've handed out press packets, and we'd be happy to follow up with any questions you might have at a later time. And we appreciate your attendance today and look forward to working with you on this important issue as we get new news. Thank you.
Thank you.